After you're asleep, the surgical team will make a midline incision from the breastbone to the navel. Opening this incision reveals tissues that connect the abdominal muscles. Another incision is made through these tissues to allow access to the abdominal cavity. Your surgeon will use a special oval ring to hold the incision open during the operation. First, the surgeon gently lifts the liver up and away from the stomach. The surgical team can now see the place where the esophagus and stomach join. Then the surgeon cuts away the tissue that connects the liver and the stomach. This gives your doctor better access to the diaphragm and the esophagus. Next, the surgeon pulls the esophagus upward and closes the hiatus with sutures. Your doctor may insert a rubber tube in your esophagus to keep the sutures from tightening too much around your airway. Some hiatal hernias can cause persistent and painful acid reflux, and your doctor may decide to correct the problem surgically. In this case, the surgeon divides and separates the arteries that supply blood to the top of the stomach. After freeing the stomach from the spleen, your doctor wraps the upper portion of the stomach around the esophagus and sutures it into place. A rubber tube is placed in the esophagus to keep the wrap from becoming too tight. The special ring is withdrawn. The tissues that join the abdominal muscles are sewn together, and the skin is closed with staples. Finally, sterile dressings are applied.